Welcome, everyone, to another edition of 45 Forward, where our mission is to help you, our listeners from Los Angeles to Long Island, age successfully, making your second half of life even better than the first. While we hear every day about the latest twists and turns in the evolving COVID-19 pandemic, we are actually in the midst of another pandemic, a relatively silent one, the Parkinson's pandemic. Parkinson's disease is the world's fastest growing neurological disorder, increasing in virtually every region of the world. In the US alone, the economic cost exceeds $50 billion a year, a staggering $50,000 per person with the disease. In today's episode, we talk with Dr. Ray Dorsey, professor of neurology at the University of Rochester Medical Center and co-author of a thought-provoking new book, Ending Parkinson's Disease, A Prescription for Action. As one of four leading physicians who co-author this book, Dr. Dorsey calls for a bold, comprehensive approach to help end Parkinson's called PACT, which stands for Prevent, Advocate for, Care, and Treat the Disease. He'll talk about the most promising treatments on the horizon, from immune therapies to vaccines, surgical treatments, and new developments in nutrition and microbiome research. He'll talk about the troubling use of certain pesticides and toxic chemicals linked to the disease, which particularly affect farmers, veterans, high-tech manufacturing workers, as well as the rest of us. Dr. Dorsey will also outline some of the latest advances in care, including the dramatic increase in the use of telemedicine to treat Parkinson's patients. And he'll examine the lessons learned from other health crises, from polio to AIDS to COVID-19, and how we might apply them to this pandemic. And finally, he'll give us an action plan for what the average citizen can do right now to help end Parkinson's. Parkinson's disease is not an inevitable disease that happens with age, he says. It is a preventable disease, and we need to get around to preventing people from developing it in the first place. So now let's meet today's guest, Dr. Ray Dorsey. Ray, welcome to the show.
Thank you very much for having me, Ron. My pleasure to be with you.
Great. Now, Ray, before we dive into our discussion about Parkinson itself, I'd like to start just by asking you a bit about your background, how you became involved in this kind of research, and how you came to work with these three authors to put together this book.
In 2017, in an in-person meeting in New York City, there was a celebration of the bicentennial of Dr. James Parkinson's seminal description of Parkinson's disease. So Dr. Parkinson was a 61-year-old physician in London, and he was writing about a condition that he said had not been classified in the medical literature. And so in the span of 200 years, we went from a very likely extraordinarily rare disease to one that's now the world's fastest growing brain disease.
Wow.
My colleague, Bas Bloom, and I said, well, let's write a piece on this. We called it initially the Parkinson epidemic. Mm-hmm. And our third colleague, Michael Oken, was the editor for the journal. He said, why don't you call it a pandemic? That's what I called it a ways ago. And then one other person at the meeting was Todd Scheer, who used to be the CEO of the Michael J. Fox Foundation and still an executive vice president there. And so through happenstance, and a chance meeting, we came up with the idea to write a book because the first piece resonated strongly with the community.
Right. Yeah.
And there's one more thing. The real thing is we were also motivated in that piece called the Parkinson pandemic by the action of HIV activists. So, mm-hmm. We're dealing with a infectious disease right now that's killing and harming lots of individuals. It's not the first time that we've done this. In the 1980s, there was a unknown virus that was killing large numbers of individuals, large numbers of younger individuals, and we had a muted federal response initially. And that vacuum, a group of HIV activists adopted a motto of silence equals death. And for them, ACT UP and others led by Larry Kramer, changed the course of HIV, not only for those with HIV, but importantly for those without HIV, and prevented thousands, millions of us from ever developing that infectious disease. And we saw that the work that they had done in a great book by David France called How to Survive a Plague, and that really motivated us to think about what we could do for the Parkinson's community.
Oh, that's a good backstory to have. I really appreciate hearing that. So let's just talk before we talk about we can talk about lots of things, and we will talk about lots of things, but just for our audience, just give us a quick synopsis, Ray, about what we know about the disease in terms of how it affects the neurological system in the brain.
So classically, the textbooks will tell you that Parkinson's disease is a brain disease that's characterized by loss of nerve cells in the brain that produce a chemical called dopamine, and that it classically results in a tremor, usually in the hands, usually at rest, usually affecting one side more than the other, slowness in movement, stiffness, and difficulties walking or with balance. That's what the textbooks will say, and it tends to occur, the incidence, the number of new people with the disease triples every decade. So your audience is people in 45 and older, so it's incidence is X at, if X incidence is 1 at 45, it'll be 3 at 55, 9 at 65, 27 at 75, and keeps going on and on.
Wow. Wow. Yeah. So, so it's, yes, it's characterized. So I know what category I'm in. So, so it's characterized by tremors, and I guess it's not clear what the causes are. I mean, I guess, again, the textbooks would, talk about, sometimes specific genetic mutations, but what causes them and how they interact with various other factors, I think is the thing that is really interesting that you pointed out.
Yeah, so so there are some genetic causes. They're relatively rare. A famous neurologist, William Gowers, wrote in the late 1800s that only about 15% of his patients have a family history of the disease, and that's largely proved out to be the case. And if you took 100 people with Parkinson's in the US, about 15, maybe 20% of them will have an identifiable genetic risk factor for the disease. Only about 1% of those individuals will have a genetic mutation that's sufficient to cause the disease. The rest will just increase their risk of developing it. Said another way, 80% will not have any identifiable genetic risk factors. So we've known for 100 years that Parkinson's is predominantly caused by environmental factors, and led by great work by Dr. Caroline Tanner and her colleagues at UC San Francisco and hundreds of others, dozens of others. We know what are very likely to be the contributing factors to Parkinson's disease. Chief among them are certain pesticides. Many pesticides are nerve toxins. They target the parts of nerve cells that we know are damaged in Parkinson's disease. When we feed some of these pesticides to laboratory animals, they develop not only the pathological features of Parkinson's disease in their brain, but they actually behave as if they have Parkinson's disease. They're slower in their movements. There's an industrial chemical called trichloroethylene, widely used in dry cleaning, used to clean silicon wafers in Silicon Valley, used to decaffeinate coffee in the 1970s, found in carpet cleaners, dry cleaners, and many other applications. Increases the risk of Parkinson's disease by 500%.
Wow.
And then air pollution, the ambient air pollution that's around us in many cities, caused by either factories burning coal or by automobiles, it also likely contributes to Parkinson's disease. So the central thrust of our book is that Parkinson's disease is likely dictated by these environmental factors, some of which interact with the genetic factors. And to the extent that we call this a man-made disease, we as humans can end this disease.
Wow. Wow. Yeah, I'm not sure how widely that's known, about the disease, the interaction with environmental factors. I did, some initial reading, I think a previous interview with you, when you talked about, starting in, the disease starting, being noticed in London in 1917,
1817.
I'm sorry, 1817, right. When the air pollution was so bad that people walked around with masks like we're doing today.
Yeah, so people who watched The Crown, right, they saw the London fog, and the London fog has little to do with weather and everything to do with air pollution. And air pollution really started to affect London as early as the 1600s, but by the 1800s, after we had the steam engine, you started getting, such polluted environment in London that you couldn't even see across the street. You had to have little boys carry fires or torches so that people can make their way through the crowded streets of London. And since that time, several studies have linked air pollution along with certain heavy metals that these small little tiny particles carry. And these tiny particles can actually bypass our normal brain's protective mechanisms, enter in through our nose, and carry toxic compounds directly back into our brain and contribute likely to Parkinson's disease and Alzheimer's for that matter.
Wow. Wow. Yeah. And I think you noted too that one of the fastest growing areas now is China, right? Where there is a significant, pollution problem.
Yeah. So if you look at the epidemiology of Parkinson's disease, the areas of the world that are most industrialized, like the United States and Canada, have the highest rates of Parkinson's disease. Areas that are least industrialized, like sub-Saharan Africa, have the lowest rates of disease. in areas of the world that are undergoing the most rapid industrialization, such as China and India, have the fastest increasing rates of the disease.
Wow. Wow. So are policymakers, and I guess in terms of influencers in this country, are they aware of this, or I guess they're somewhat aware, but it doesn't seem to have, caught the attention, as it seems like it should, since it's, yeah, as you said, it's something that we can control.
Yeah, I think by the nature of the disease, policymakers in the United States and elsewhere in the world tend to be older, and so they have friends and family members who have Parkinson's disease. German Chancellor Angela Merkel was rumored to have Parkinson's disease. Vladimir Putin's been rumored to have Parkinson's disease. The father of Justin Trudeau, the Prime Minister of Canada, died with Parkinson's disease. The mother of Prime Minister Boris Johnson in England has Parkinson's disease. So they should be familiar with Parkinson's disease. The reason we had 2 elections of 2 Georgia senators this past November was because the outgoing senator Johnny Isaacson had Parkinson's disease and chose to retire because of the disease. So after having served for a few years with the disease, so they should be aware of it. I think people are, but there's still too much silence around the disease, not enough funding for the disease, and not enough action to address these preventable factors that are contributing to the disease.
Right. And one of the other things you mentioned as preventable factors is pesticides, right? So that's another, large area.
So yeah, the good news there is that this year the EPA banned a pesticide called chlorpyrifos, widely used on golf courses, used on Washington State apples, used on utility poles, fences, and other fruits and vegetables, and they banned it. And so that action is going to save millions of children IQ points and going to prevent thousands of people in the United States and hopefully eventually around the world from ever developing the disease. That's the good news. The bad news is that the EPA reauthorized or plans to reauthorize the use of a pesticide called paraquat. Paraquat increases the risk of Parkinson's disease by 150%. It's considered the most toxic herbicide ever created when it was developed in the 1950s. It kills the weeds that Roundup doesn't. It's been used to commit homicide and suicide. In over 30 countries, including China, have banned it, but the United States still permits its use. England bans it, but still exports it to Brazil, Mexico, and the United States. We have a chance to prevent people from ever developing this disease, and we can do that by banning certain pesticides that other countries have done so. And the sooner we get about to doing that, the sooner we prevent thousands, if not millions, of people from ever developing this debilitating disease.
Right, right. Is it just, I'm just curious as to what the explanation is from the EPA in terms of,
you have to ask them. Their own website says 1 sip can kill, and they document individuals who, like an 8-year-old kid who older brother, I think, had put paraquat in a soda can in the garage, and the kid drank a sip and he died.
Wow.
So the EPA has made this determination. I'm not sure why we continue to allow a pesticide that's been banned by other countries, including China, Syria, the United Arab Emirates, and dozens others, to continue to be used in the United States. Few of us drive cars from the 1950s, and none of us would step in an airplane from the 1950s. I don't think it's unreasonable to expect that chemists can come up with safer alternatives than paraquat.
Right. Wow, that's amazing. Yeah, and I guess some of this stuff ends up seeping into the water system. You mentioned too that it's this cleanser is used in Silicon Valley. It's used in lots of industrial places.
This doesn't just affect farmers, although farmers are at increased risk for developing Parkinson's disease, and it doesn't just affect people who work with the chemical trichloroethylene, although those who do have a 5 times higher risk of developing the disease. It affects all of us. So 40 million Americans get their water from wells, private wells, which aren't regulated by the Safe Drinking Water Act. Those wells are in rural areas subject to contamination by pesticides that are washed off from nearby farms. And so you can be drinking, either as a child or as an adult, pesticide laced water and never know about it. Similarly, you can be inhaling pesticides that are sprayed in areas near where you live. This chemical called trichloroethylene, widely used in degreasing, contaminates up to 30% of groundwater in the United States. And so people could be drinking that contaminated groundwater, or TCE like radon can evaporate from the underlying soil and groundwater into your home, your schools, or your workplaces, and you could be breathing it in for years, never knowing that you're breathing in air that's increasing your risk of Parkinson's disease and cancer.
Right. And then I guess the last area is with veterans, I guess the interaction with some of the things that they may have ingested or been exposed to, starting with Agent Orange, right?
Yes, and so, General Colin Powell, who just recently died, he died with multiple myeloma and with Parkinson's disease, both of which have been linked to Agent Orange and other pesticides that he and others sprayed in Vietnam. In addition to Agent Orange, veterans are at increased risk for head trauma, which can increase your risk for Parkinson's disease. And trichloroethylene has contaminated numerous military bases in the United States, including most infamously the Marine base Camp Lejeune in Jacksonville, North Carolina, where up to 1 million veterans, Marines, their family members, civilians, and their children were exposed to levels of TCE and another chemical at levels up to 3,000 times that are safe from the 1950s to the 1980s.
Wow. Yeah, I mean, certainly I think people are aware in general of, the exposure to Agent Orange in Vietnam, but I don't think they've really linked it to Parkinson's, at least in the public sphere of, people's general awareness of how these might have affected it. Nor I wasn't aware, to be honest, with the Camp Lejeune exposure as well. So, I'm glad it's coming to public light, and we're making these links to increased risk factors. So, I think, Ray, we have a lot more to talk about. I want to get into talking about some of the promising treatments now and on the horizon, but we're going to take a short break. I just want people. Welcome back, folks, where we're talking today with Dr. Ray Dorsey, the co-author of Ending Parkinson's Disease, about what he calls a silent pandemic today. Before we continue our conversation, I wanted to mention that you can find out more about Dr. Dorsey and his work by going to, I believe your website is endingpd.org. Is that right, Doctor?
Yes, endingpd.org. And if anyone would like a copy of the book and they can't afford it, they can just email us at info@endingpd.org, just with their mailing address, and we'll send them a copy for free if they can't afford it. Info@endingpd.org.
Right. And I just wanted, since you mentioned that, I want to also mention, I think you've told me that the proceeds from the sales of the book will go toward your research, right?
Yeah, so all the authors, all of us, 4 of us are devoting all of our proceeds to efforts to help end Parkinson's.
Great. Thank you, Doc. So before the break, we were talking about a lot of the causes of Parkinson's, the interaction with environmental causes. I wanted to now shift to just have you talk a little bit about some of the promising treatments, either right now or on the horizon.
Yeah, so let me back up just a second. I know you do a lot of work in the Alzheimer's community, and it's kind of odd that we have 6.2 million Americans with Alzheimer's disease, and we have no highly effective treatments for it. And we have about 1.2 million Americans who've been diagnosed with Parkinson's disease, and our most effective medication for it's over 50 years old.
Wow.
So, we should not find that acceptable. I don't think there's another disease that affects more people for which we don't have highly effective treatments, and I can't think of another condition for which other maybe than some antibiotics for which the most effective medication is 50 years old. So we need better treatments both for Alzheimer's disease and for Parkinson's disease. There are some that are in the pipeline. There are some medicines that target some of the genetic causes of Parkinson's disease, including a genetic mutation called LRRK2 that affects about 2 to 3% of Americans with Parkinson's disease, and may also that gene encodes for a protein that might also be abnormal in other people with Parkinson's disease. And then just like we have some immune therapies for COVID-19, we have some immune therapies in development for Parkinson's that target a misfolded protein. It's called alpha-synuclein that's found in Parkinson's disease. And the hope, just as we have some immune therapies that are in development for Alzheimer's disease, including one that's recently been approved, that we can have some immune therapies that can target the misfolded protein that spreads throughout the brain in individuals with Parkinson's disease. But we need a whole lot more. And I also put out there, it's a whole lot easier to prevent a disease than to treat a disease. It's a whole lot easier not to get COVID than it is to treat COVID. It's It's a whole lot easier not to get breast cancer than it is to treat breast cancer, and it's a whole lot easier not to get Parkinson's disease than it is to treat it.
Right. And one of the things, as you mentioned, so I'm a fairly active volunteer doing community education for the Alzheimer's Association, where I live on Long Island. I found it interesting that some of the things that the non-pharmacological interventions for Alzheimer's and Parkinson's are similar. So exercise, nutrition, some of these things seem to have a benefit for both of these disorders.
Yeah, so if you want to sweat, it's a good, Parkinson's is a good reason to do so. So vigorous exercise in your 30s, 40s, 50s, and beyond can decrease your risk of ever developing Parkinson's by about 20%.
No.
In addition, vigorous exercise is actually quite helpful for people with the disease. A Mediterranean diet, low in animal products, high in fruits and vegetables can decrease your risk of ever developing Parkinson's and can be beneficial for the people with the disease. Protecting your head, both for Alzheimer's and Parkinson's disease, is important. So if you like to bike or ski, wear a helmet when doing so. And if you have Parkinson's disease, you should limit your exposure to pesticides and ensure that your water is clean. So since writing the book, I buy a lot more organic. I wash all my fruits and vegetables with a little soap and water, and I put a water filter on our water at home.
Wow. Yeah. Yeah. So there are lots of these, I guess they're called lifestyle interventions, which are important, but they're valuable and well, they don't cost much.
They don't cost much, and they cost a lot if we don't. If we as a society decide that we want to keep using paraquat on corn, soybeans, and cotton, we're going to pay a very high price for it, $50,000 per person per year is the economic burden of Parkinson's disease. And we should make sure that if we want to pay that price, that individuals aren't paying the price, but the companies that are producing these chemicals are the ones paying the price for it. We don't need to be subsidizing them.
Right. Right. The other thing you've talked about is just advances in care models, that support both people with the disease also and caregivers and those who work with them. Especially, you've talked a lot about telemedicine, which is an area that you've been very active in engaged with.
Yeah, if you think about it, it's kind of odd that we, as generally healthy clinicians, ask patients to come see us on our terms when we should be seeing patients on their terms. We should stop asking patients to come see us, and we should bring care to them. And telemedicine is just one tool to do that. My colleagues and I have been doing that since 2007, initially bringing care to people in nursing homes in upstate New York, and then and directly into their homes and into satellite clinics. And COVID-19 has demonstrated the immense potential of this adoption because Congress and Medicare started paying for telemedicine visits. We saw a 100-fold adoption in telemedicine visits among Medicare beneficiaries in the span of 4 weeks. The largest transformation in healthcare delivery happened in about April of 2020, when a 100-fold increase in adoption of telemedicine visits, such that I think half of Medicare beneficiaries have benefited from care received via telemedicine. Those changes are temporary. They're tied to the public health emergency at present. We need to make sure that Congress acts to make those changes permanent so that anyone, anywhere can receive the care that they need for Parkinson's disease and a wide range of other conditions.
Yeah, it seems to be a tremendous cost saver, but I think in many cases you're right in terms of and I guess it's sort of ironic. It's telemedicine, but it is going to back to a notion that was and some of which translates into actual visits. But I've noticed a number of physicians today are sort of creating specialties in home delivered care. The old home doctor visits.
And the house call was the dominant means of providing care as late as the 1930s. 40% of patient-physician interactions occurred into the home. And telemedicine isn't just really focused on decreasing the cost of care. It's about fulfilling the vision of Medicare. So when Medicare was created in 1965, its goal was to ensure that all older Americans had access to healthcare at a time when only half of them did. And many people don't happen to live near Rochester, New York or Chicago, or happen to live near a center where there's lots of Parkinson's specialists. We need to enable patients to receive the care where they live, regardless if they live in Springfield, Illinois, or Utica, New York, or Long Island or in Savannah, Georgia, or Greensboro, Alabama. And we need to make sure that they can be able to receive the care that they need. They paid taxes for the last 50 years for that explicit purpose. And telemedicine is a powerful means for them to be able to receive the care that they need in their homes.
Right, right. Now, certainly, I understand that there are some circumstances, and I'm an example of this, where I think it was around March or April of 2020, just as as the pandemic started to pick up steam, where I had a serious inflammation condition, and so initially I did have uh, an on-site visit with a rheumatologist, but once I did that, there are some times when the physician needs to be there with it, and they need to be able to examine you and touch you. But once they did that, once my doctor did that, then she and I, then our subsequent visits were telemedicine. I mean, she basically had done the exam. She knew what I was talking about. If I held up my hand or pointed, she knew what I was talking about. So I didn't need to physically go to the her office after that, and it was very effective. It saved us both a lot of time, and same. I got the kind of care that I needed, and I think especially for your area of Parkinson's, getting patients to facilities is an ordeal sometimes.
Yeah, yeah. I once went to UC San Francisco, and if you have Parkinson's disease and you want to try to go to the University of California, San Francisco, good luck. I had trouble getting in and out of the parking lot. I'm a relatively healthy guy. I can only imagine what it's like for Parkinson's disease. We have not designed care around the needs of people with Parkinson's disease. My co-author Boss Bloom and I said that we couldn't design our care for Parkinson's disease much worse than we do. I like your idea about some combination of in-person and virtual visits. Would work great for some people, but some people can't drive. People with Parkinson's disease have impaired driving ability. They have overburdened caregivers, and they have limited financial means. And we've made care extremely inconvenient for them. And telemedicine is a tool, not a panacea, to address some of the inequities and shortcomings in our current care models.
Right, right. So the takeaway you mentioned is that at least one immediate thing is to extend, the emergency use of telemedicine that we have through Medicare, right? So that's
Listen, there are 50 million Medicare beneficiaries. They pay taxes for the last 50 years to get care. That care should be dictated by their needs, not by the preferences of hospitals and doctors. And if your listeners make their voices heard, tell their Congress members and senators to ensure that the Medicare's coverage of telemedicine is made permanent, so that they and future generations can benefit from receiving care on their terms instead of doctors and hospitals' terms. All of us will be better.
right, right. I guess there's a term now that's called, patient-centered medicine, but this is what it's all about. This is what it should be all about in the first place. Yeah. Patient-centric approaches. Yeah. So let's, we have a couple minutes before the break, but I just wanted to sort of shift a little bit to, research funding, and you've noted that it's really lagging behind. $50 billion a year, $50,000 per person with a disease. Half of the healthcare costs half of the costs are in healthcare, half in the costs of lost wages due to disability, early retirement, excuse me, and financial burden on caregivers. And that, the cost of Parkinson's and Alzheimer's together are going to be astronomical if we don't really make some progress.
So I mentioned the HIV and how a group of activists made their voices heard and turned federal funding from $0 to now $3 billion per year for HIV. HIV affects roughly the same number of Americans as Parkinson's disease, and the NIH budget for Parkinson's disease is about $250 million. So 1/10 of what it is for HIV. And that HIV funding has not only accelerated the development of new therapies for HIV, it's prevented thousands of millions around the world from ever developing. HIV, probably one of our most robust investments in healthcare that we've ever made. At the same time, the number of Americans has increased over the last decade by 35%. NIH funding for Parkinson's disease, adjusted for inflation, has actually decreased. I can't think of another condition for where that's the case. If we don't have an Operation Warp Speed, as my colleague Michael Oken and co-author has called for, we're going to suffer with a large number of people getting Parkinson's disease. 200 more will be diagnosed today. 100 more will die with the disease today. $250 million for a condition that has an economic burden of $50 billion is not going to get it done.
Right, right. And I think that, well, certainly, I think one of the issues is that there is not enough public exposure to this. I think I think people are aware, and again, from my own experience, unfortunately, I mean, it's Michael J. Fox. He's sort of for me, the public face that you see. He's his foundation. He's still continued to work even after he was diagnosed. So he's brought some awareness, but we need much more. Now, are there any? Where's the research taking place? So you're Rochester. Where's the major research taking place? Or
so the research takes place at a large number of research centers throughout the United States. Just a word on Michael J. Fox. It's hard to have Parkinson's disease. It's hard to have Parkinson's disease and to be the face of it. He's made the biggest difference in Parkinson's disease in this century. His foundation, thanks to him, has raised over $1 billion for research funding, but that man cannot do it alone.
Right.
There's 1.2 million Americans who have Parkinson's disease, and he's Canadian. I mean, he needs a lot more help. Davis Finney, Brian Grant, others are making their voices heard and lending their voices. But if we stay silent, if we don't follow the page book from the HIV activists, if we stay silent, we're going to have a lot of needless and preventable suffering. One of my patients is caring for her husband with Parkinson's disease, and she said, "This is no way to spend your golden years." And so if you don't want to spend your golden years with Parkinson's disease, if you don't want to spend your golden years caring for someone with Parkinson's disease, then you need to make your voices heard. You need to tell your congressmen and representatives to ban pesticides like paraquat, ban the chemical trichloroethylene, which contaminates up to 30% of groundwater in the United States, and increase research funding for Parkinson's disease, and make sure that research funding is not only focused on developing new treatments, but that research funding is focused on preventing people from ever getting the disease in the first place. I just assume not get prostate cancer. I don't want chemotherapy. I don't want to be cured of prostate cancer. I don't want to get it in the first place. And we can prevent people from getting HIV. We can prevent people from getting lung cancer, and we can prevent people from getting Parkinson's disease. We just need to make our voices heard and end the silence around this disease and many others.
I hear you with that. Yeah, I mean, I think that like one of the things I think that I've often felt is that we don't focus on healthcare; we focus on sick care.
Yes.
And I think that sometimes I'm a little bit skeptical in the sense that, well, we focus on that because we make more money doing that.
Yes. Don't be skeptical. That's exactly why. So American medicine is very good at going from disease to treatment. But what I want your 1.2 million Americans with Parkinson's disease to think is disease and why. Why do I have Parkinson's disease? If we don't answer why I have Parkinson's disease or breast cancer or heart disease, until we answer the question why, we're only resigning future generations to get the disease. If we start asking why, we will find answers. We will find answers for why we have 1.2 million Americans have Parkinson's disease, why women, 1 in 8, 1 in 10 women have breast cancer. We'll find answers, and we'll prevent future generations from ever developing diseases in the first place.
Right. Yeah. And I think that, especially for my audience, 45 and older and even younger, as you reach that age, I mean, you can lead a terrific second half of life, each chapter active and vigorous, as long as you have your health, and that's the wild card. Even when people start planning for retirement, it's like, well, when you have to think so much of your retirement costs have to be shifted to healthcare, then what kind of retirement are we having? And I think that this is so it's critical that health is considered as part of the equation.
It is the equation. It's hard to enjoy life if you spend the last 15 to 20 years of your life with Parkinson's disease. You can still live a full and healthy, can live a full life, but it's much harder to do it when you have a debilitating disease that robs you of your independence.
Right, right. So, welcome back, folks. We're talking today with Dr. Ray Dorsey, the co-author of Ending Parkinson's Disease. In our first two segments, we talked quite a bit about the disease itself, some of its causes, the links to environmental factors, and some about the treatments. And we began to talk about what we can do about it. So I wanted to take this last segment to dig more deeply into that in terms of what can we do as average citizens. Ray's mentioned a little bit, but you mentioned a little bit before, but you've also, we need active participation, partnerships. So how can we Talk about your approach. Let's talk about this PACT approach of yours.
Yeah, so we outlined the book 25 things that individuals can do. We even color the pages gray in the book. So if your readers want to get a copy of the book on Amazon, or if they can't afford it, email us at info@ndpd.org. They can see it. The first is we need to ban the chemicals that are fueling the rise of Parkinson's disease. And the two most egregious ones are one, the pesticide called paraquat, sprayed on, still sprayed. Use of this paraquat has doubled in just the last 5 years. Despite over 30 countries banning it. And this chemical called trichloroethylene, which some countries in Western Europe have banned, but is found in over half of Superfund sites throughout the United States. And the way we can make our voices heard is to join a global grassroots organization called the PD Avengers. Larry Gifford, who's from Ohio and is now lives in Canada, formed this global grassroots organization called the PD Avengers, pdavengers.com. There are over 4,000 members strong from 70 different countries. And you can join them to make your voices heard. And that's a grassroots organization created and run by people with the disease. And we need a lot more Avengers out there so that the voices can be heard from the community, and so that we can prevent future generations from ever developing Parkinson's disease. You know, as a neurologist, as a physician, I can think of few things more rewarding or more worthwhile than to get rid of diseases so that future generations are free from them. And previous generations have gotten rid of polio, essentially, for us. Previous generations have fought against polio. Previous generations have fought against drunk driving. And a lot of us are living today and have friends and family members who are living today and unharmed because of their efforts. We need to do the same thing for Parkinson's disease, so future generations do not have to bear the burden of what is now the world's fastest growing brain disease.
Right, right. And anything in terms of supporting new kinds of care models? But
so we talked on the care front about making sure that Medicare makes coverage of telemedicine permanent.
right.
We also need to find other care models that enable people to age in place and live in their homes for as long as possible. 88% of Americans want to live in their homes as long and as independently as possible. And currently we have very limited means for doing that. We've seen the shortcomings of institutional nursing home care in the setting of the COVID-19 pandemic. We should be mindful of that and think about ways to enable that people to live either in their homes or their own communities for longer portions of their life.
Yeah, I think that is critical. I think that is, catching up a bit. I think there's, I know in where we are in New York State, there's been more funding released in terms of providing, help excuse me, in terms of home care. Um,
And I think some of that was actually in the recent bill that President Biden just signed, was increasing some coverage of home care for home care for either through Medicare or Medicaid.
Yeah, and I think as you pointed out, it's a two-pronged benefit. Certainly there are cost efficiencies and keeping people at home as long as possible, as long as it's feasible and medically supportable. But it's the efficacy and the of the care itself. It's not just the cost. I mean, you get better care, and I think that you've noticed that there are a lot of people who can, especially dealing with Parkinson's, who can help support this in the home, right? I mean, physical therapists, other kinds of clinicians who come into the home. It's better for the Parkinson's patient as well, right? Not to travel and see these people.
Yeah, and less risk of infection and more community support and more social support. And we need to provide additional respite care for caregivers, who bear an enormous burden of disease. 35 million Americans care for an older adult in this country, and the number one reason for that are brain diseases. We need to provide additional resources to support that.
Right, right. So, what is your dream? Basically, it's to end Parkinson's, right? That's your goal.
Listen, we've done it before. I mean, no one's sitting around worrying about smallpox. No one's sitting around worrying about polio. Few of us worry about our teenagers. We still worry about our teenagers, but we worry a little bit less about them getting hit by a drunk driver. But we worry about that less because of organizations like Mothers Against Drunk Driving and others. So we can get rid of diseases. And if we get rid of diseases, then we can save a lot of money and turn our attention to other diseases and start getting rid of disease instead of adding new ones like COVID-19.
Right, right, right. Yeah, as you mentioned, the there's no cure for polio, but it can be prevented, and we've done that.
Yes.
Yeah. Yes. Right. Right. Um, so what else can we talk about? Are there things that you'd like to talk about in terms of your own research, or what? Oh, well, you mentioned to me earlier during one of the breaks that you have a sequel to your book coming out.
I'd say we're in the early stages of
Well, even
right,
so,
right,
even
of
so.
writing a book. I think it struck a nerve, and I think people want to learn more about these environmental causes of the disease. And we think some of these environmental causes are not just fueling the rise of Parkinson's disease, but are fueling the rise of Alzheimer's disease. One of the big factors fueling the rise of Alzheimer's disease is air pollution. So I alluded to that our brain's really good at keeping infections and toxins that are circulating in our blood from entering our brain. But there's a front door to our brain, and that front door is called our nose. And many of these pesticides we inhale, trichloroethylene, this degreasing agent we inhale, and air pollution we inhale. And so anyone who lives in LA has seen smog, and in that smog are these tiny little particles. They're called particulate matter, pieces of dirt and soot. And those dirt and soot, many of them get caught in the hairs in your nose or hairs in your throat, and you cough them out or sneeze them out. But some of them are really, really, really tiny, and they bypass our normal filtration mechanisms and can enter in through our nose and reach our smell centers in the brain, and then from smell centers in the brain spread to other regions of the brain. And these small little tiny particles have some dangerous hitchhikers on them, including toxic metals like lead and iron and platinum that can then enter and damage different parts of the brain. And it's worth noting that Parkinson's disease and Alzheimer's disease, the first part of the brain that's affected is the smell center or olfactory bulb, suggesting that these diseases actually may not begin in the brain. They may begin outside. They may begin even outside of humans and in our environment. And the sooner we clean up our air, the sooner we get rid of these pesticides, the sooner we get rid of trichloroethylene, the fewer of us will be affected by these brain disease.
Yeah. Have there been any kind of comparative studies just looking at different areas of the country or other countries where there's pollution and non-pollution, and just comparing the
Yeah,
incidence?
so as I told you at the outset, for Parkinson's disease, the evidence is pretty good. Our estimates are crude, but they tell us a story about the most industrialized parts of the world have the highest rates of the disease, and the least industrialized parts of the world have the lowest rates of disease. And India and China, which are undergoing the most rapid industrialization, have the fastest increasing rates of the disease. One country in the world where the incidence appears to be actually decreasing, the number of people affected adjusted for age is decreasing, is the Netherlands, where my co-author Bas Bloem is from. They have among the cleanest air in all of Europe. They've long since banned trichloroethylene. They've banned many pesticides. And so when you look at the levels of pesticides, some of these dissolve in your fat. You can measure fat, measure the pesticides levels in the fat. They are lower. So we've actually seen some early signals of success in some areas of the world when we change our behaviors. And if we change our behaviors for along like the Netherlands has, I think we're going to see fewer people affected by these diseases. If you take a step back, every society creates its own diseases. And, for us, we created lung cancer. Lung cancer almost simply did not exist in 1900 America. People just didn't die of lung cancer because no one had lung cancer. It wasn't until the advent of cigarettes that we saw a rise 25 years later in the number of people with lung cancer. We get rid of smoking, we get rid of a large proportion of individuals with lung cancer. We get rid of air pollution, we're going to get rid of a lot of lung cancer, we're going to get rid of a lot of heart disease. And I think we're going to get rid of a lot of Alzheimer's and Parkinson's disease.
Yeah, yeah. I think obviously it was just too short a period, really. But I think that certainly at the onset of the pandemic, when we really were shut down for a while, people did notice fairly quickly, the decrease in air pollution in LA, right? And people were like,
Yeah,
whoa, I could
had
see.
cleanest air ever recorded in history. Conversely, when we had the fires in the West, the most polluted city in the world became Denver, Colorado.
Yeah.
So if you want to talk about man-made diseases, we're creating a lot of this. And you don't need a pandemic to reduce air pollution. In Paris, France, they have a day where they don't drive cars, and levels of noxious gas in Paris drop by 40%. Air pollution is very, very, very tractable. If we change our behavior, we'll see almost immediate changes The level of air pollution will prevent children from ever getting asthma, will prevent people from getting lung cancer, will prevent people from ever dying from heart attacks, will prevent people from ever getting Parkinson's disease, and will prevent people from ever getting Alzheimer's disease. It's on us to act, and we can see changes in short periods of time.
Right. Yeah, we're making very small steps. I guess there's a car-free day in this country too, but it's just a day. I mean, it's a little more than that. Yeah. So, any more words about? I know that we have in terms of what people can do. They can. I just want to mention again. You can go to endingpd.org, your organization, and if they go to the website, they can donate it too, right? They can
donate on our website, and we have a Parkinson's project, which we are focused on identifying the cause of Parkinson's disease. We think this chemical trichloroethylene, TCE, is found in, I told you, half of Superfund sites in the United States, found in 15 in Silicon Valley alone, I think 12 on a 7-mile stretch of the 101 freeway in Northern California. It's found in thousands of sites just in the state of Michigan alone. We found a site 15 minutes from where I live in Rochester, New York, where people were drinking water from a spring that was contaminated with TCE, and was leading to a high rate of brain cancer in the community, and at least one individual had Parkinson's disease.
Wow.
So we're investigating a cluster of people with Parkinson's disease in Rochester, New York, that we think may be due to this chemical that's been widely used by dry cleaners. And it's kind of crazy that we're using chemicals to enable us to have dry cleaning, so we don't shrink our clothes. And this is fueling the rise of cancer, leukemia, non-Hodgkin's lymphoma, renal cell carcinoma, kidney cancer, liver cancer, and Parkinson's disease. And we stop using this chemical, we can prevent people from getting these cancers, including children, and prevent people from getting Parkinson's disease. And that's what we're using some of our funds that we're raising through the Parkinson's Project to identify these causes and eventually to eliminate them.
Right.
The sooner we eliminate them, the sooner people will live in a world that's free of Parkinson's.
Yeah. Do we have, are there substitutes for the kinds of chemicals that dry cleaners are using?
Yeah, I told you that pesticide was created in the 1950s. Trichloroethylene was created in the 1920s.
Wow.
So I think a century of a chemical is enough. That there are companies that even advertise safer alternatives to it. There are dry cleaners that are using safer alternatives to trichloroethylene and its related chemicals. I think we can certainly, over 100 years, come up with safer chemicals.
I'm with you on that. Wow. Well, I really appreciate your being on, Ray. It's been a very valuable, very informative discussion. I know we can still keep talking more about it, and we'll have you back. Well, it may be a little bit before your second book comes out, but we'll have you back and perhaps bring along some of your colleagues. But go ahead. Yeah.
I'll just say that, generations before us got rid of polio. A generation before us changed the course of HIV. Why don't we be the generation that changes the course of Parkinson's disease and prevents millions of people, both in the United States and from around the world, from ever developing this debilitating disease? We know how to. If we make our air cleaner, if we make our water cleaner, and we make our food cleaner, we can do that and not only derive benefits from reducing Parkinson's disease, but a wide range of other conditions as well.
Yeah, I hear you, and I appreciate that. That's a worthwhile mission, and I'll support that. So, folks, once again, tell your friends if they missed my conversation with Dr. Ray Dorsey today, you can still listen to it as a podcast on voiceamerica.com. Just search my show 45 Forward. You can find it on Apple and Google Podcasts, Spotify, iHeartRadio, or go to my website, roelresources.com, and click on the 45 Forward tab. And you can listen, you tell your friends they can listen to Ray on that there as well. So folks, be sure to join me next Monday, 12 noon Pacific, 3 p.m. Eastern time, when I'll be talking with Howard Schneider, the founding dean of the Stony Brook School of Communication Journalism, about his long and enterprising career in the news media, the changes he's seen on the way, including his groundbreaking course on news literacy. So folks, until then, keep moving forward, 45 Forward.